AM 1480 WLEA.
Our guest today, Dr. Ismail Mehr.
Next on News Talk, AM 1480 WLEA, the Newsmaker Show with Kevin Doran.
I'm Brian O'Neill, in for Kevin Doran, talking about the future of Hornell's Hospital, St. James, with Dr. Ismail Mehr. Doctor, thanks for joining us.
Thank you for having me, Brian.
Dr. Mehr, Dr. Byron Collins, he spoke at Thursday night's town hall meeting about St. James. That was at the main place on Main Street in Hornell. And Dr. Collins, he did not have a positive view of the future surgical suites being set up at some point in North Hornell. He kind of dismissed it as a place to take care of, he used the phrase lumps and bumps, meaning an emergency room for stitches and Band-Aids, not too much more. Now, people like you and like Dr. Byron Collins maintain that that really is not going to cut it. Mayor Sean Hogan, he said on WLEA here Saturday morning when we asked him why he thinks that it's a contrived crisis, which is a phrase he used at the Thursday night town hall meeting. And Hogan says he does just not believe the numbers anymore. He maintains that St. James' parent corporation, Trinity Health, just wants to close the place down, St. James, just like Catholic Health East did before Trinity Health bought out, or merged with, I should say, Catholic Health East. Here's what Hogan said Saturday morning.
It's a contrived crisis only because now CHE is merged with Trinity Health, and Trinity Health definitely doesn't want to run this hospital. And so rather than try to manage it and right the ship, they're just going to walk away.
Here's another statement from Hogan from that same show Saturday morning.
There's no reason, that we can't at least sustain some inpatient beds. They're sounding this drumbeat. They're sounding this drumbeat that it's not sustainable. I'm not buying it, and the community shouldn't buy it.
Pretty blunt words there from Mayor Sean Hogan. Your take, Dr. Ismail Mehr.
Well, I think it's a two-part question. So the first part regarding surgical services, as the current proposal has set forth, I think it's important for everyone to understand that the proposal that the administration, Catholic Health East, in conjunction with oversight from University of Rochester, have put together, has what's called an ambulatory surgery center. That basically means that you can do very smaller, minor procedures and surgeries where you don't require to be hospitalized afterwards. Things of nature like probably cataracts and hernias and maybe ear tubes and pediatrics and maybe some urology procedures, things of that nature. It absolutely does not mean that one has a teenager, your teenager has an appendix problem, goes in and they say he has appendicitis. He's not going to be taken care of here in Hornell. They're going to have to be shipped out because it will have no ability to do anything emergent at all.
What about tonsils?
Well, you can do tonsils here in an ambulatory surgery center, but I want to make a strong comment, which I've discussed with the administration in our meetings and whatnot, and what brings concern to me is you have to understand is, and Dr. Collins alluded to this as well, and I'll try to clarify it so everyone understands it much, much more. When you have an ambulatory surgery center and you're doing these types of surgeries, first and foremost, our community at large, we have an elderly population. Not everyone is completely healthy. I myself, right now, I obviously I'm the chief of anesthesia here. I'm very, very well in tune of what our patient population is, and we take care of some very sick patients. And God bless our OR staff and our hospital and everyone who works here. We have great results. We had a 99.9% satisfaction rating a few years back for ambulatory surgery at the hospital, and we took care of our population of sick patients. Who have diabetes, who have heart disease, who have a cardiac stent in, who have this and that, and they require tender, loving care before, during, and after surgery. In an ambulatory surgery center, a lot of those patients won't even be able to be done here because you don't have the medical backup. If something does go wrong, you can't keep them here. There is nowhere to keep them.
You said a few moments ago, Dr. Mehr, appendectomies would not be done in Hornell at the new facility. What other examples can you give of things that won't be able to be done in Hornell if this plan goes through?
Anything emergent, it won't be able to be done here. And I wanted to try to allude to and make people understand is even the things I recommended, or I wouldn't say recommend, I suggested that could be done here, really can't be done here. The reason being is, as I said, you would have to be a completely very straightforward, healthy person, has no real medical problems, to undergo a hernia procedure here, or to undergo a urological procedure here, or this or that. Because the sicker you are, or the more diagnoses you carry, there's the more likelihood chance it's not rocket science that something could potentially go wrong and you need to remain overnight in the hospital, or you need more medical care. But there's something very important that I foresee doesn't add up in the sense that it's not practical, is that we're 20 miles away from the nearest hospital. So I could be taking care of you, Brian. I know you're a fairly healthy guy. You're having your hernia done, but as Dr. Collins said, you don't know what's going to happen until you get going. And something goes wrong. And we take care of it. We stabilize you, but we need to get you to a hospital because we don't have the beds. We don't have the medicine doctors here. We don't have the doctors here to admit you. And even if we did have the doctors, we don't have the beds now. So if anything goes wrong in any surgery, you'll first of all, we'll have to stabilize you and then get you in an ambulance and get you off to the hospital. Right now, all the time, we have issues that happen in the operating room. Something unexpected happens, and we're well trained. As an anesthesia department, as surgeons and nurses, we take care of it. We work with the patient in the recovery room. We call up Dr. Randawa or whoever the hospitalist is on. We say, hey, this patient went into congestive heart failure. Nothing of our doing. It happens sometimes, and we'll get them upstairs and we'll get the right treatment taken care of for them. Get them on, and then we'll get them home in a few days, and everything was fine. And the patients and the family are very thankful because we gave them the utmost care. But now, if anything like that happens, we're going to put you in an ambulance, and we're going to send you to Dansville or to Jones to be taken care of. It just, it doesn't make sense. And the counter-argument is that there's surgery centers all around the country, and that's absolutely true. But if you pull up the data and look at it, majority of surgery centers are in metropolitan areas. If you look at Rochester alone, I think I can name you 5 or 6 different surgery centers.
But that's a lot bigger than here.
Well, of course. But no, you have to understand is these freestanding surgery centers, they're all within 5 miles of Strong Memorial, RGH, or Unity. They're so close. And I've worked at those surgery centers because I trained in Rochester. They don't do anyone who's not a ASA Class 1 or Class 2 patient.
And what does that mean?
And that's basically a scale that we use that the American Society of Anesthesiology has put together. It's from 1 through 5, and it rates you on how much risk you carry of having a potential problem during surgery. And 1 and 2 is the lowest, 3, 4 is the middle, and 5 the highest. So trust me, even in the big cities, at the surgery centers, it's strictly ASA Class 1 and 2 who will go there, who will be taken care of, because, you just need to have the right backup plan in place. So, you asked me if you could do tonsils in Hornell. Yes, you absolutely could at a surgery center. But I know most ENT surgeons, especially, Dr. Patrick, he's great. I can guarantee you he wouldn't do it in a surgery center because the risk of postoperative bleeding in a tonsil patient is fairly high. It happens, and now you're in a place that's 20 miles away from the nearest hospital.
There are basically now 2 schools of thought. There's the camp that says that there is definitely going to be lots of job cuts at a smaller medical facility in North Hornell. Then there are those who want to prevent the hundreds of job losses and those who still want to have the same inpatient services and surgeries at a Hornell hospital. That's Kenneth Steele Streeter moves to North Hornell. They don't want to lose the jobs and they don't want to lose the inpatient services. You, Dr. Mehr, you're part of the group that says save the jobs, save the hospital, keep the inpatient services we have now. So question for you. Those in favor of the new facility, and that comes from the administration like Jen Sullivan, they argue that more and more medical services are being provided in doctors' offices. You did touch on that a moment ago, saying that the surgical surgical centers that are in places like Rochester are very near Strong Memorial. But I'm wondering, your wife, Dr. Mehr, brought up at the town hall meeting last Thursday in Hornell, can 300 babies be born a year? And can all of these serious surgical procedures be done in a place like Dansville or a small doctor's office somewhere? That's my question, not hers.
Let me back up a little bit. Now, the part two of the first question was about, it seems like that there's a mission, so to speak, on CHE and Trinity's part to no longer have a hospital in town, and I think Sean is right on point there. There's no hiding that. Unfortunately, they wanted to put the hospital up for sale for quite some time, and it's just they haven't been able to find a suitor. And as any businessman does, when they don't want to run a business anymore, they try to sell it. Didn't work. So now, their plan is to basically walk away. I think Sean's absolutely right in that assumption, and there's no hiding that. And the state has been very, very, very accommodating in forcing or persuading, might be a better word, CHE not to walk away, and has actually funded the money for this last year.
Tell us a little bit about that.
Well, I mean, last year, I believe March, the hospital ran out of money. Now, you have to remember, CHE and Trinity Health, they're a major, large healthcare organization. I don't remember if it's 20 or 26 hospitals up along the East Coast from Florida up through, I believe, Massachusetts. I think the next one in New York State is in Albany. I believe it's called St. Joseph's, and don't quote me on that, but it's a larger institution. We're the smaller of all their hospitals and the least important, so to speak, when you're the smallest member of a big conglomerate of hospitals. They wanted to close us down. I think that's led to the vicious cycle of why we haven't had any growth, medically speaking, in Hornell for the last 6-7 years, because when the parent organization really doesn't want to keep this facility, they're not going to put the energy, the efforts, the money, and whatnot into trying to bring in newer surgeons and newer this and newer that, or helping out. I mean, kudos to the administration and Jen and them, because they got the orthopedics in here and they got the other people in here, and that's really not with the overall whelming support of the parent company. It was sort of a ground root efforts here. So that's no doubt about that they want out, and it basically leaves a void here for us. Going to your second part of your question, in terms of what can be done, what can't be, can noise handle this, can they not, and the jobs and all that, I'll bundle that all into one quick answer or lengthy remark here. First and foremost, no one here on the Save Our Hospital committee, which is quite extensive with physicians and community members, no one is asking for status quo. And I think Sean made that very clear, because I think in the town hall meeting that came up, that status quo cannot work. We understand that. Status quo meaning the hospital, the way it is, just financially won't work. You cannot have a facility that large, with that many employees, with that many beds, with that many executives, with that many, ancillary staff, and you name it, it won't work. Dr. Annabelle was right on the money. The money that comes in from Medicare, Medicaid, and managed health care just doesn't cut it anymore. And the problem is our facility is too large. So we don't want status quo. What I was suggesting, and I mentioned that at the town hall meeting, is we went from one extreme to the other. What about the middle ground? And not even middle ground, because middle ground would mean 60 beds or 50 beds. We're talking going almost all the way to the left, so to speak, but still keeping small inpatient presence, 15 beds. Maybe 4 of them are for OB, 11 are for patients, 2 or 3 operating rooms, a full-fledged hospital, and a smaller, compact facility that where heating and cooling and all those processes are efficient, where you don't need to have maybe 3-4 dozen different nurses. Again, some jobs will be lost. There's no doubt about it. I don't think a smaller facility will be able to save all those jobs, and that's going to be unfortunate, but it's much, much better outcome for the community to have health care that's comprehensive, and it will still retain a lot more jobs than having just an emergency room that sees patients and doesn't offer any of these services. So from a job standpoint, the current proposal drastically reduces the jobs.
We're talking with Dr. Ismail Mehr on the Newsmaker Show. Brian O'Neill filling in for Kevin Dorn. More in just a moment. Stay with us. Back on the Newsmaker Show, Brian O'Neill on the phone this morning with Dr. Ismail Mehr. Dr. Mehr, you suggested at the town hall meeting last week that Hornell do something about getting a smaller hospital, not just an emergency room and some doctor's offices scattered around. Question here for you. Why is a hospital better than just having an emergency room and then a bunch of scattered doctor's office?
Well, I mean, that's a no-brainer. I mean, think about it. We have a population of about 8,500 or so patients, people with problems, with illnesses, and who need to be hospitalized. I mean, right now I was on the floor the other day. I mean, it was packed, it was full, and none of these patients were 24-hour observations. They were there, needed to be there for a few days. I mean, we need to have a hospital with an inpatient presence. It just has to be smaller, more efficient, and more in line with current healthcare trends. I mean, you still can offer all the outpatient services, which I agree most of healthcare majority focus is outpatient, but that doesn't mean that there's not an inpatient component. And I think Jen Sullivan was very clear. She said she's not the one saying she doesn't want inpatient care. She just said we can't afford it. So we have to find a way that we can afford it. And I think, it's unacceptable to say that, well, we'll just go with the solution that doesn't have it, and we'll try to use noise and Jones to make up for that. As Dr. Annabelle mentioned, I mean, we need to emphasize to the state, to the federal government, if they need to subsidize something, they need to subsidize it to make it work. But subsidizing the current facility is the status quo, as I was saying earlier, won't work. It's going to cost too much. It's not practical. But a smaller, more compact, efficient facility, I'm sure it would do fine. I mean, I look at Wellsville. Wellsville's been doing financially fairly well, and I think Sean alluded to this, and others did too. How's the payer mix different between Hornell, Dansville, and Wellsville? So that's where I think Sean really is convinced of the contrived crisis, and I'd have to agree with him that, if the parent company sort of stops watching you and stops looking after you, well, it's a vicious cycle, and you're going to just keep on losing more and more money, whereas the other hospitals in the region, they've done things to capture the market. They've done things to make some money, and we haven't. And unfortunately, we're the ones who are going to suffer if this plan goes through. We'll lose our hospital.
Another point that both Jen Sullivan and Dr. Spencer Annabelle bring up is that 63% of the patients who come into St. James are on Medicaid because they're on low income. Jim Cummings, the representative from Oak Orchard, the Brockport-based healthcare company that's applied for a grant to come to Hornell. Oak Orchard says they get a lot of funding from a federal agency and that they can help those out who are on low income and without insurance. Now, a question for you, Dr. Mehr. Is it possible to run a hospital like St. James when the majority of patients are on something like Medicaid?
I'm not a business guy, and I'm not going to claim to be one. 63% is an enormous number, and it's not. In my honest opinion, it's probably not. It's not practical to be able to run something at 63% loss all the time. However, something smaller, more compact, more efficient, your losses are much less. I mean, I would still foresee a loss in rural health care in this region. But then, there's others who very quickly point out that Wellsville and Dansville, they must have 63% as well. Okay, if they don't have 60, they have 55. And then that makes me wonder, how are they continuing to survive? And I think that there was a point made by Sean was that you close us down, you're going to send our 63% to noise. So then how are they going to continue to run? So I'm not sure what the answer is, and I apologize. I can just look at the numbers and say, well, if you push 63% of Medicare, Medicaid population over to noise, how are they going to continue to stay open? And I don't think our payer mixes are much different. We all know Dansville's about 4,500 people, Wellsville's about 4,000, Hornell's 9,000. So
I think it's about 8,500, yeah.
Yeah, exactly. So, and I'd like to say that we have a little bit more of an affluent and a professional population in Hornell because of the businesses and industry we have around town. So I'm not sure how that all pans out. What I do know, and I feel very, very strongly about, is a smaller hospital. That's not so big, not so expensive to run. Has maybe half the employees we have now, to maybe even slightly less than half. It should at least be in a proposal to the state. And if there is some deficits there, that's where we use our ties with the politicians and say, hey, well, we're not going to be losing $6 million a year anymore, but we may lose $500,000 or so. Is there some sort of money out there that we can apply for that'll help take care of the population that is not insured or does not have the coverage that pays better.
Now, if we've talked logistics, we've talked finances, if we could talk a little bit about the human part of the story. Your wife, Dr. Mehr, and we mentioned this, she said at the Thursday town hall meeting, the Noyes Memorial in Dansville delivers 300 babies a year, and she said Hornell delivers about 300 babies a year. You yourself at that meeting said there would be tragedies happening on the way, meaning pregnant women would run into serious medical problems on their way over to Noyes from Hornell in the Hornell area. A few weeks ago on this show, Dr. Spencer Annabelle warned those suffering from heart attacks against driving all the way over to Dansville if they were having a heart attack in Hornell or Canisteo or one of those towns. Annabelle said they might not make it. Okay, so here's the question. We need medical care in Hornell, which serves a higher population than Dansville and Wellsville, as you pointed out, Dr. Mehr. So let me ask the question again. Where can all of this be done with the plan that they have, or would the smaller version of a hospital idea that you have work out better?
Well, no doubt a smaller hospital better serves all these needs. There's no doubt about that. And the current plan has been thought out. They've looked at a lot of things. I mean, they're not cutting corners by any means on that. They're just, unfortunately, services are being cut. But when you cut services, that is going to put people at risk. A freestanding emergency room, when you get there, you'll get stabilized and you'll get sent out. Whereas right now, when you come to St. James, and if you're having a heart attack, depending on what kind of heart attack you're having, Dr. Randawa or the hospitalist on call may admit you and treat you here. Or if it's, a certain degree, a level of heart attack, I'm not a medicine guy, but if there's different things going on, they will get you out of here on a chopper to Strong or somewhere if you need to have an intervention. But not everyone gets sent out. But now, anyone's having a heart attack, if they come to the Hornell ER, they're just going to barely get stabilized, and they got to be sent out to the hospital somewhere. So Dr. Annabelle's correct. You're going to be in transit for a long time. There's no doubt about that. In terms of maternity and services, I really thought my wife was very, very. Her last remark was something that is the most important, and I hope many people heard her out. Is when she mentioned that the babies in Hornell, they deserve the minutes to fight for life that the babies born in Dansville do, and the babies do in Wellsville. And what she was saying, so that everyone understands, is if you're having a baby, you make it to Hornell, and it gets delivered here, or delivered at home, or in the ER in Hornell because you couldn't get in the car and drive all the way to Dansville, and there's a problem. And let me tell you, not all babies come out crying, screaming, and sucking on their thumb. They come out and they need help, and we have trained nurses and doctors and whatnot to do that for them. But now when it happens here, and that baby's not doing well, and now you got to put them in an ambulance and hightail it over to Dansville. I don't care if it's summer or it's winter and there's a blizzard going on. Your minimum time is 20 to 30 minutes, depending on the weather. But just 5 minutes makes a difference in that baby's life.
And we have audio of what she said.
Now, if most of the people are going to go to Dansville, they're not big enough to take on this 300 influx of pregnant women.
She was saying there that Dansville is not going to be big enough to take on this influx of 300 more babies a year that they'd be getting from the babies that would have been born at St. James if St. James exists.
Right. No, absolutely. And I think that's a different issue. That's a different problem. I think that's something for the administration at Noyes. I hope that they're ramping up and they're thinking about how they're going to handle all this. Because let's be very obvious and clear here. Hornell's geographic location and migration pattern is not going to be towards Wellsville. Wellsville's not going to get any patients from us. I mean, I think that's fairly clear, and that's not any disrespect to Wellsville. Their hospital and their staff is very good there. I know people over there, but our pattern's to drive north. So Dansville's the one who's going to get all our patients. But, that's a second issue of problems. But the first problem is, I think, I want to harp on that again, is minutes make difference in a neonate's life. In a newborn's life, those minutes make a difference. And not every mother's going to get over to Dansville to deliver. Trust me. We have Amish women coming in all the time who from Jasper, which is far enough, and we're in. It's sort of our adrenaline is rushing. They hit the doors. The ambulance is like she's bleeding. The mother unfortunately is bleeding out. She had a bad delivery at home. The baby's not doing good, and we're ready to go. Now imagine trying to get that person all the way over to Dansville.
Got maybe 30 seconds left. Any final thoughts before we go?
I think the final thought, the only thing I'll say is, we have a week or so left on the petition drive. I want people to get out there and really get them signed. Get those turned into City Hall by the 12th of December. I know they're all over the place, and we don't have record of where they are, so just turn them in. But really, get vocal, get involved. You may think that St. James is not a big part of your life because you're very healthy and you have no issues, but trust me, at some point down the road in your life or one of your loved ones, there's going to be a need for emergent care or the need to be hospitalized or the need to be treated and seen by professionals, and that may no longer be here. And it's going to, affect everyone and as individuals and as a community adversely. And lastly, the effect it's going to have on the community when you lose health care here, you lose the doctors, they start moving away. I mean, just from a community sense, we're going to lose Hornell, and we've been hearing so much positives lately in the newspaper and the news with what the IDA has been doing, and I just see that that potentially all is going to come to a standstill if we lose the hospital.
Dr. Ismail Mehr, thank you very much for joining us.
Thank you.